Can you share a little bit about who you are and what you do and how you came into your position?
I've been working as a perfusionist since last 14 years. So since last 5 years, I'm working as an ECMO specialist. I resigned my job as a perfusionist in India in 2016. Then I was working as a freelance perfusionist for some time, like for a few months. And I got the call from an ECMO company in Kuwait asking if I would like to join an ECMO project here. They wanted to start a project. So 2017, I came here. We started, I met with Dr. Huda Al-Fodri and Dr. Shamsa, who is ECMO directors in Adan Hospital. So the ECMO project went really well and they wanted to hire me to the ministry. So I joined the ministry in 2018. Since then, once I joined, we have got intensive training under Dr. Nicole Reagan from Guy's and Thomas, if you know. And there was a team from Erasmus University. So we got so many intensive in-house trainings from team outside as well as our doctors inside. Yeah. Now we are doing our side of training. We started doing in-house trainings from our hospital since 2019.
That's so awesome. And what is your specific position where you're at right now?
Currently, I'm the chief ECMO specialist here. I was the only ECMO specialist coming from perfusion background until last year, until COVID. My hands were full and tied. So I'm mainly the clinical educator for ECMO. So I trained the perfusionists and nurses. Since COVID hit, we had too many cases. We had to start off so many centers, ECMO centers, as we were not able to retrieve all the patients from all the hospitals. So we hired more people. Now we are a big team here. We are a team of 10 perfusionists and 40 ECMO nurses. Only in Adan, we have got perfusionists and nurses hired for other hospitals as well, other ECMO centers as well. I think Al Adan team has started the foundation and helped build the foundation for all the hospitals in ECMO centers in Kuwait.
That's amazing. That's amazing. And then you said specifically in your role, you do a lot of education. Yes. For perfusionists and nurses. What kind of education are you doing for them, and what is the format that you guys follow?
Our training is modeled after ELSO guidelines for training and continuing education of ECMO specialists. Although initially we had team from Guy's and Thomas and Erasmus University to help us start the program, help us start the education program. Now we have a full-fledged training program. We do the phase 1 training, that how it's said in the ELSO as well. We do the phase 1 training for the selected doctors, nurses, and perfusionists, where there is pre and post-course assessment and certification. Then we do have a quarterly phase 2 training where all the certified specialists have to complete the quarterly competencies. Although that's not mandatory in high volume centers, as per ELSO, we try to do that as well.
That's awesome. What do you love about your job?
All right, that's a question. So coming from the perfusion background, thing is, we do not get emotionally connected to the patients. You know, we work with the sedated, intubated patients, prep for the surgery. We don't get the chance to emotionally connect with the patients. I'm talking from ECMO specialist coming from the perfusion background. All right, there was a point I thought my career as such is stagnant. It's not exciting anymore. And what am I going to do with it? I mean, I've been doing perfusion since last so and so years, and I got that excitement was done with. Then I happened to join to the ECMO. ECMO from a perfusion point of view, until then, most of the perfusionists think of ECMO as a sidekick to CPV. It's kind of a sidekick to CPV. It's a smaller version of CPV. That's what even I thought. But getting into the ECMO, after getting into this intensive training workshops, what I learned was ECMO is not just about initiation or coming off CPV. It's not just the technical part that we have to understand. It's all about managing the ECMO. That's the most trickiest part. How to manage? Why my SATs are not going up? Why my CO2s are not coming down? What is happening with my patient? Understanding that physiology of ECMO, physiology of the patient is very tricky in ECMO. So I love the education part that ECMO is providing to me. I love the new things that I'm learning. I think that's what I love about my job. I like I know it's, you can say there is pros and cons dealing with a non-intubated patient, but it's nice to get connected to the patient. It's nice to see them leave healthy. It's nice to see a dying patient leave healthy out of the hospital. It's nice to talk to them, see how they are struggling and coming out of that emotionally. So I love that. We are dealing with the most, the sick here, most sick patients in the hospitals. So most of the patients are, if you see, like 80 to 90% mortality without ECMOs, and we are giving them a 50 to 70% survival chance. So if you ask me, we have a 187 days old, like the patient was on ECMO for 187 days, and she has been weaned off last week. We were together with her all throughout her journey, and we see her breathing her own since last 1 week. We extubated her, we decannulated her, she was out, then she was in again, she struggled, she was out. So we see that process. We see, we talk to the patient relatives, we see how happy they are. So I think as ECLS specialist, particularly as ECMO specialist, that's what makes me happy, to connect with the patients.
What have you noticed changing within the ECMO community over the last 2 years?
Okay. I think the major change that I had noticed in the ECMO community is that ICUs are taking charge of the management. Before I have seen, at least where I was trained, it was majorly, the ECMO was majorly the business of the cardiac team and the perfusionist. I had not seen much involvement or a multidisciplinary team involvement. But now, as it became more needed and more popular, especially with the COVID, we see that intensive care team has started taking ECMO more seriously. And the patients who are not recovering on vent is getting a chance. They are getting a second chance. There is something beyond ventilator. We are telling the patients, we are telling the family, we are telling the world that ventilator is not the last choice. There is something beyond ventilator. I see increasing number of perfusionists, RTs, nurses, and doctors who wants to get trained in ECMO. This is becoming more popular. They want to get trained, and I hope in the near future, every hospital ICU team will be updated and trained and be aware about the ECMO concepts.
And how many new ECMO centers and ECMO specialists have you trained over the last couple of years?
I would say I have personally trained around 70, 80 or more. I don't know, around 100 to 150 if I take all the numbers. But as a certification, we have trained 40 perfusionists plus around 60 plus nurses as certified. But there are people who work as ECMO specialists with certification, without certifications. So who have registered for the certification and yet to attend the courses. So if you include that, the numbers would be still higher, but at least around 100 we have trained so far in last couple of years.
That's awesome. What kind of structure or setup do you guys have for your ECMO team? Is it perfusion-led, nurse-led, respiratory therapist? And then what is the ratio of ECMO specialists to circuits that are managed?
Yeah, again. We have the ECMO program director, co-directors, the coordinators, specialists, which specialist, our ECMO specialist majorly comprises of perfusionists and nurses. We, unfortunately, we do not have RTs in our team. We have majorly perfusionists and nurses. So if I talk particularly about my center, we have 10 perfusionists and 40 nurses. So that's like 1:4 perfusionists and nurses. And we have a 1:1 ratio with ECMO patient. So we have sometimes if the patient is all right and manageable, then the nurse, the ECMO specialist will be working as a bedside nurse, because the numbers are too many, like 150 cases, 155 cases we are doing yearly. So sometimes our bedside nurse and ECMO nurse are same person, but we will have at that time, we will have a perfusionist to cover. So that's how it works.
Awesome. What would you say is the greatest challenge for ECMO specialists today?
I think the answer of what I like most about ECMO and the greatest challenge should be the same. ECMO comes with so much emotional package, again, you see the patients sometimes extubated of ECMO. You see them eating this, you see them walking around on ECMO, you sometimes talk to the family, and all of a sudden those patients whom you think will survive the ECMO cannot make it. So that's really a big baggage that we are taking home. Sometimes we cry. Sometimes when we lose some patients, we cry. So that's a big part of emotional baggage that we take home. There's another challenge I can say is I'm coming from I was working in India. I'm coming from a developing country, So sometimes even with all the knowledge, expertise, and resources, we cannot provide the service to few deserving patients as it's too expensive. They cannot afford it. So I hope that someday it's going to be affordable like any other essential medical service, and like the ventilators that we use. I hope it's one day everybody in the world everybody who is deserving can afford this. I think cost is a biggest challenge for our decision making, whether the patient requires that ECMO or not. Cost decides it sometimes. So I think that's a big challenge that we need to work on as a global ECMO community, and the companies also should work on how to cut the cost and run it. I think so.
Yeah, that's a good point. That can be very, very challenging in making those decisions. Can you share an encouragement? What would be something that you would share to ECMO specialists all around the world today to encourage them?
See, ECMO specialists, we come from different background. Some of us are nurses, some of us are perfusionists, some of us are RTs. We come from different background. We all have our own core strengths. So what I think is we have to work together as a team, and working together as a team, I've seen wonders happening. I mean, also we need to ask questions to ourselves. I always tell my colleagues, always ask this question, why? Why am I doing this? Why is this not coming up? Why am I not able to get him out of this? Sometimes you get stuck with a 500 sweep and you're not able to come down from that point. The patient desaturates. You are able to get the patient down to 500 sweep, 0.1 ml of sweep, 0.5 liter of sweep. And from there, he's not coming down. Sometimes you see pregnant patients not able to wean the sedations of the pregnant patients. So you need to keep asking the questions why. So it's simple. You need to keep it simple. Just ask why. Why is this happening? and find the answers, discuss with, people whom we know, shed our egos and discuss with people who knows better than us. So I think as a team, we can work way better than if we work alone. So I hope that's an encouragement, isn't it?
It is. It is to me. Just collaboration and teamwork and communication and always asking why. And sometimes asking why gets challenging when you're 100 days in, you know, when it's the same, kind of the same, not the same thing, but
You do the same, you redo the things.
yeah, but we do have to look at
Interesting.
it with fresh eyes every single time. And like you said, ask why, and even ask people around us, because sometimes they have a better perspective or a fresh perspective. You
Exactly. You do not have to be much experienced, but people will have different perspectives. Even if you're coming from a very, you're a fresher in ECMO or you're experienced in ECMO, maybe a fresher can give a different perspective of thought to, because you have learned something and you have to unlearn it. So a fresher can give you a better perspective of what's happening.
so true. It's so true. I love that. Um, can you share something you've learned over the last couple of years that would be helpful for ECMO managers and educators?
I think unlike any other professions, medical professionals cannot afford to make mistakes. We have to learn from others' mistakes. So what I have learned is we need to constantly update ourselves, and we need to sometimes unlearn what we learned. Sometimes what's in our head might not be true, might not be correct way of doing it, but we might be believing that's the correct way of doing it. So constantly update ourselves, constantly read the articles that's coming out, go through the ELSO. ELSO is very resourceful in that aspect. And I appreciate your work as well. ECMO resource team is also doing, I don't know if you are, how you find the time to do it, but you guys are doing a wonderful job in helping us do that, helping us updating ourselves. So I think it's all about updating ourselves into the newer techniques, newer practices, and clean our head, make a clean slate. Learn something new every day, so that what you're doing today, what you're learning today, might help someone have a better life tomorrow. Help someone live a better life tomorrow. So I think, yeah, learning is the best process.
I love that. That's so good. Um, so you guys are a gold center of excellence, is that right?
We are
And
also gone.
so when did you guys achieve that? Was it last
I,
year? 2019
I
maybe?
2019, maybe 2019. I think so.
Okay.
Sorry,
And
2020. I think 2019.
okay, that's so awesome. And how is that going? And how was that journey and process?
It was, there is so much of paperwork, so much of this education academical works to be done. But our ECMO director, Dr. Huda Al-Fodri, she is a wonderful person who supports she's our head of the department as well. So there is no conflict of interest there. So she is doing a great job. She has been supportive of this program since day one. And Mm, I think it's her involvement that made the program such a big success in Kuwait. And there is Dr. Shamsa, who knows the physiology in and out. He's a very good teacher, I would say. So he gives different perspectives about every case to whoever is coming and attending classes. So his physiology classes are awesome. We worked really hard. We as a team worked really hard. We had but yeah, as I said, Dr. Huda has made it happen. It's her work that made it happen. All applause to her.
That's wonderful. Congratulations.
Yes.
Awesome. Is there anything else that you'd like to share?
do you want me to share anything else? Nothing is coming into my mind.
No, that's all that I sent over to you. Unless you have anything else on your mind that, you know, comes to mind or.
Yeah, I can actually talk about the best case or the best moment of ECMO I have had, Okay, there was this Indian lady who was 24 weeks pregnant, who was COVID positive and on ECMO. And no, she was intubated. She was not on ECMO then. There was this, there were discussion about how to proceed with her treatment. There were opinions coming that from one side to deliver the baby and to give mom a better chance at 24 weeks. It's difficult. The baby was too premature. And after all the discussions, we decided to put the mom, to give the mom and baby a chance. And we put her on VV ECMO. She was on ECMO until 28th week of her pregnancy. We had a C-section on ECMO and a beautiful baby girl. She was intubated for around 3 days and extubated. And I saw them after 1 year. It was beautiful. I mean, the mom and the girl all healthy. She was such a bubbly girl. She was not even looking like a premature baby. She was healthy, hale, and God bless them. I think that was one of the best moments I've had in ECMO. My ECMO journey, that was one of the best moments that I've had, I can say. Actually, that's the most rewarding thing about ECMO. Sometimes these small things makes it so worth. We were so tired during those days. I was posted in a different hospital. We were so tired, like duties were so harsh. We were very less in number. I had to shuttle up and down to different hospitals at that time. But this was the best moment and I had a 2-month-old baby at that time, and my baby was just 2 months, so it was too emotional me to accept her. So I cannot forget that baby's face until now. I saw her deliver on ECMO, so I cannot forget that baby's face. It was so worth it. It was worth all the effort.
For sure. I love that. Thank you for sharing that.
What about you? What was your best case?
Wow. I feel like there's so many for different reasons, I think one of the more just rewarding and memorable, when I was in my beginning days as a nurse and learning about ECMO, I took care of a gentleman who was waiting for lungs. So he had CF and was put on VV. He was probably cannulated for at least 2 to 3 months while he was waiting for lungs. And working through, as with individuals who have, medical problems where they're not able to breathe easily already, being put on ECMO, just working through anxiety, the fear, the physical therapy, talking through that. And so many times you become their friend, and in a professional way, but just you spend so much time with them, And I remember our transplant surgeon coming in and talking to him and to the family about the lungs that they potentially had available, and asking, because they have to give permission, and talk through that whole process. And so I remember he had gotten so comfortable with ECMO, it was kind of like it was just a part of his everyday. And because we had worked through all of the anxiety and everything, he had gotten to a point where he not enjoyed it, but he just felt like it was his new normal. And so when she came in to share with him about this new set of lungs that he could potentially have, he said, no. He said, I don't want them. I want to stay on ECMO.
Really?
Yes. And so, and if you think about the psychology of it all, it makes sense. But at the same time,
You must
um,
have done a really good job with him. I mean, our patients just remove it off. They cry. They sometimes move it themselves.
yeah, yeah. So he, that was a whole process. He physically became very distressed, even thinking about receiving lungs and not having ECMO. And so just working through that with him and getting him to understand that this was the best thing, and we had to make this step, and he couldn't live on ECMO forever. And so he did get his lungs, and it was a recovery process. And then after the surgery, teaching him, it was okay to breathe and take deep breaths, and working through all of that. I think that journey, along with so many, was very rewarding. And then seeing him after all of that, he would come back and visit with his wife and thank us and all of the above. And I really enjoyed that. I enjoy the process, like you were sharing earlier. And it's challenging and it's long and it's hard, and there's so many things that come along with it. And there's not always, good stories afterwards or positive stories, but the ones that you do see, make it worth it all, and even if you're able to give people longer time in life so that they're able to understand all of those things and work.
Giving them time to say goodbye. Do you feel that sometimes you give to say goodbye? There are things that's left unsaid. So I wish I had to say that I had told before leaving. Then I have seen patients do that as well.
Yes. Yes, absolutely. So that's a good memory I have. There's so many, so many. But I like the
I,
process of it all. And I remember starting our program where I'm at now, and everybody on our team was brand new to it. And they would ask me in the beginning, very in a heartfelt way, is this going to help? Like, how is this going to help? I don't believe that this is going to help, because they had seen so many people not survive. They're like,
they
how is this even possible? And I loved that I was able to speak to that and say, it will help. And just wait and see, it's going to help, and just the kind of fear, but then excitement on people's faces. And then when we decannulated our first person, oh my goodness. Some people were in tears, just with the miraculous thing that ECMO does. And so I think for me, seeing our team and the process of them working through all of that has definitely been rewarding.
beautiful. It's rewarding. Yes. After all the hardships we have gone through, I think we need these small rewards. At least I think all the medical professionals are drained physically, mentally. We felt like we were abused at some point, I feel. But yeah, this is what makes this job rewarding.
Yes, and I appreciate all that you're doing over there and what you're helping your team with, and moving forward. I think it's so cool that you guys started with one center and now there's so many, in that area.
It's
It's
it's almost 6 centers now in other 6 ECMO centers in Kuwait. Like
wow,
almost or every area we have got centers.
wow.
It's really a wonderful job that I think that